Hello everyone, how are you? Welcome to the physioBRAIN channel. This is Professor Adriano, and today we're going to talk about and give you some exercise tips to help reduce pain in your hip. A large part of the population suffers from this pain, dealing with aches and difficulties in the hip joint. And today we're going to give you 3 simple tips on how to reduce pain and turn that into a better quality of life for you, so you can improve your quality of life by feeling less pain. And don't forget, go ahead and subscribe to the channel, like the video, and share it with anyone you think needs this information. So, hip pain, right? Our hip is responsible for absorbing a good part of the impact, the load we put on it throughout the day when we walk, right? It's very common that over the years some type of degeneration develops in this joint. It's very common to see cases of hip osteoarthritis. It's very common to see inflammations in this region. The muscles often end up getting weaker. There are shortenings, tendinitis, right? And this makes it more likely for more pain to appear. So it's very common, right? As a physical therapist, I've already treated several cases of hip osteoarthritis, and I've also treated many hip prostheses that were necessary due to osteoarthritis, a very advanced degeneration process, or often because of fractures that required hip prostheses as well. Okay, so today we're going to give you 3 simple tips that you can do on your own in your daily life, which will help relieve your hip pain. Always remember that ideally you should do these exercises under professional guidance with the supervision of a physical therapist. But if you don't have access to one at the moment, you can still do them, and I am very confident that this will help you reduce your hip pain. All right? If you already have a medical condition, if you have had a hip replacement or anything like that, do not do these exercises without professional guidance. It's always important to remember that, okay? So everyone, what do we need? What can we do to reduce hip pain? So we're talking about a structure that is compromised, right? The bone structure. You know, often there is an impact on the joint there that causes the pain to increase, okay? So we need to reduce this pain, all right? So what are we going to do to work this musculature, to work this pelvic region, okay? We're going to do 3 exercises that we will be demonstrating. For one of them, we ask the patient to bend their legs. So you're going to bend your legs, all right? And then what are you going to do? You're going to ask her to, as if she were squeezing my hand down there. So squeeze, that's it, and release. Squeeze, just like that, and release. That's it. Squeeze, just like that, and release. Very good. Notice that we're creating a movement of pelvic retroversion and anteversion, okay? And this movement is excellent for helping to reduce hip pain there, all right? And the next exercise we can do, keeping this position, is to ask her to lift her hips. That's it, a little less, and hold in that position. We count 1, 2, 3, 4, 5. You can lower it. And in the same way, you can keep progressing by holding for longer, more seconds, and increasing the number of repetitions. This exercise will build a lot of strength and will also help reduce pain in that area. All right? And the last exercise we're going to suggest to help reduce hip pain is to have the patient lie on their side, right, in the lateral decubitus position. Or you can do this exercise yourself. Then, without lifting your foot here, we're going to open and close. Ask them to do this lateral abduction movement. That's it. Open and close. Open and close. Open and close. Open and close. Did you like these 3 tips? Practice them once or twice a day. I'm sure this will help reduce your pain and give you more and more quality of life with less pain in your daily routine. Take care, and I'll see you in the next videos.